morning, everybody. Good afternoon. This is Michael Munson with Forge. I'm happy that you have joined us today to talk about care, compassion, and creativity, looking at trans survivors and forensic exams. Today's webinar is going to be lengthy and detailed and a little bit different than some of the webinars that we often do, which is a little bit more generic or a little bit less body specific. The intended audience for today are sexual assault forensic nurse examiners, as well as medical advocates and others who work in allied professions. Of course, we welcome anybody who would like to learn more about trans survivors and forensic exams, but the target audience is very specific. Let me briefly start with a little bit about who Forge is, just to give you a point of reference. We are a 26-year-old transgender anti-violence organization that is national in our scope, and we do have some programming here in Wisconsin, where I'm based. But for the most part, we do technical assistance for victim service providers across the country. About 25% of our work is working directly with trans survivors and loved ones, specifically around sexual assault, intimate partner violence, hate-motivated crimes, and other associated intimate crimes and victimization. We'd like to thank our funders, who are in part the Victim of Crime Act, who has helped us make this webinar possible. This is one in a series of 6 webinars that they have helped support. I want to remind folks at the very beginning, and many of you who have been on one of our trainings before have seen this slide, and it's a reminder to all of us to take care of ourselves. Because this is recorded, you can obviously stop at any point in time and come back later, or find whatever support it is that you need to be able to engage in this content. So our agenda for today is fairly simple. We're going to remind you all of some very, very quick 101 data and a few statistics. We trust that you will already have this information, so we will not spend a lot of time focusing on that 101 material. We'll spend the majority of our time today talking about the barriers that trans people experience, both in general in accessing victim services, but mostly in particular to trans folks accessing forensic care or care directly following a sexual assault. We'll have a few notes in there about disclosure and dysphoria and how that plays a role for forensic examiners. We'll then focus on what forensic nurse examiners can do and what medical advocates can do to support trans victims and trans survivors. We'll end with a few resources where you can gain more information. So let's set the stage with just a couple of reminders. I promise that we will get to the heart of the webinar soon, but just to make sure that we're all on the same page, let me do a quick reminder of a few things. So when we think about who transgender people are, a lot of us have a specific image in mind of who trans folks are. And I just wanted to remind folks that at Forge, we have a highly expansive view of who we include under the transgender umbrella or the spectrum of transgender people. So we include anyone who identifies in any way differently than the sex that they were assigned at birth. There are literally millions of ways of being trans. So as many people as are trans, there are that many ways to be trans in this world. There's no singular capture of who trans people are, other than when we listen to and engage and get to know the trans person that we're working with. You may hear people using any number of words to describe themselves. You'll generally hear me today using the word trans, and when I say trans, I often am usually including non-binary people and people of a wide range of gender identities and gender expressions. Because we're living in the middle of COVID, you may see my cat's tail, which you just saw. So hopefully we can all have a educational experience even with our pets during these COVID days. So you may hear as, SANEs and medical advocates, people talk about their identity in terms of being trans, being non-binary, being agender, being gender fluid, being polygendered, many, many, many words that people may use to describe their gender identity. A reminder for folks that trans people may or may not take specific action steps around medical choices and options, social actions and options, and legal actions or options. So not everyone might desire to transition medically or to make medical choices with regards to hormones or surgery or other medical interventions. It also might not be something that's affordable for some people who would like to make those changes to their body. Legally, some people may change their name or their gender, and some people might not. Some people may do court-ordered, some people might not. Those are all personal choices about what somebody is doing to affirm their gender identity and their gender expression. Similarly, people may take some social actions around their gender. So, maybe coming out to different people, maybe living their lives in a way that was different than what they lived as before, lots of different social options. So those are the three categories that we tend to think of where action might happen with regards to trans people. We'll talk a little bit more about that as we move on. So just a quick reminder that roughly between 0.6 and 1% of the population is transgender or non-binary. When we break that 1% down, we can see that roughly a third of folks identify as trans men or trans masculine. Roughly a third are identifying as trans women or trans feminine. And the largest piece of the pie from this really, really large survey of almost 28,000 people identified as non-binary. So when we're looking at providing services to sexual assault survivors who are under that big trans umbrella, we are looking at the fact that many non-binary people will be coming in through your doors. So it's important to recognize how some of the gendered systems that many of us have in place may be impacting the care and how that's received and how it feels for that non-binary person watching you have perhaps a gendered body map. We'll talk a little bit more about that too as we move along. So let's talk very quickly about the rates of violence, just again to give you a grounding sense of where we're coming from. Trans people overall through multiple studies have experienced sexual assault at a rate of 50 to 66%. So many trans folks have experienced sexual violence at some point in their life. We also know from multiple studies that around half of transgender people have experienced intimate partner violence. So some numbers are higher than this, some numbers are a little bit lower than that, but that's generally the two figures that we'd like you to keep in mind. The other two slides of data that I'd like to share with you are the rates by gender vector. And so when we look at folks who were assigned male at birth and are identifying more as female or as feminine, and we look at people who were assigned female at birth and who are now identifying as more male or masculine, we can see on this chart on the screen that when we look at childhood sexual abuse, adult sexual assault, intimate partner violence, and stalking, the rates of violence are almost identical for gender vectors across all of those four crimes. So a lot of times we think of these crimes as more heavily women oriented. And the data that we've conducted, as well as other sources, are showing that the gender vectors are pretty similar in terms of the rates of violence. And the one last slide that I'd like to show you with data on it is around polyvictimization. So if you have a survivor coming into your office for a forensic exam, please do know that it is highly, highly likely that that survivor has already experienced another form of victimization at some point in their life. So polyvictimization is highly common. Many trans people experience childhood victimization as well as adult victimization. So just keep that in the back of your mind as you are working with the client that has experienced something new. So I'd like to just remind us a little bit about pronouns. And again, we will get to the heart of what we're talking about today in a moment. But pronouns are essential, and it's one of the things that you're going to hear me talk about several times today because it is so important for trans survivors to feel validated in their identity. So both their name and their pronouns. So I strongly encourage you to take away that point, if nothing else today, that it's really important to ask people what their name is and their pronouns are so that you can reflect that language back to them. So I was looking for very specific examples of some name tags that people might use. So many agencies and hospitals and healthcare systems are moving towards including pronouns in their signage, in their ways of identifying their employees. And I wasn't able to find exactly what I was looking for, but you can see by the examples on the slide that some agencies, like the one on the left, is from the UW Health Center, and Rachel's plaque or name badge doesn't have her pronouns on it, but their company, UW Health, has pronouns that are branded that have pronouns on them. So their staff can choose which pronoun button they would like to include that gets taped or stuck to their badge. On the right side of the screen, you can see that this particular person, Joseph, is a student midwife, and he has his pronouns listed on his name badge. So we encourage folks, if you can, to put a sticker on, to wear a button, or to even encourage your, your facility or your agency to allow you to be printed, have printed on it your pronouns. I'm going to show you a video which is really wonderful about how to ask folks their pronouns. I think this is one of the things that people oftentimes feel a little bit frustrated or confused about, is like, well, how do I ask? Well, this video is a great way to remind us of how simple it is to ask.
The first time you ask someone what pronouns they use, it may feel awkward. You may even be worried that you'll offend the person. But assuming someone's gender and getting it wrong could actually be more offensive. This is called misgendering. If you happen to misgender someone, acknowledge your mistake, but be aware that over-apologizing can just make things more uncomfortable. Just say you're sorry and move on. As with anything else, practice makes perfect, so let's walk through some examples to make it less intimidating. Here we are at the local library. Here we are at the local library with Brian and Star. Brian greets Star at the book club meeting.
Hi, my name is Brian. I use the pronouns he and him. How about you?
What's great about this scenario is that Brian shares his own pronouns before he asks for Star's. This breaks the ice and makes the exchange conversational rather than one-sided. Sometimes, you might be mid-conversation and realize that you never asked for the person's pronouns. It's not too late. If that were to happen, Brian might say,
Star, I just realized I never asked what pronouns you use.
Asking about pronouns is becoming more common, but not everyone is used to doing it. Putting pronouns into practice sometimes involves managing reactions. If Star responds with,
Why are you asking me this? Isn't it clear?
Brian might say,
I ask everyone this question because I want to be respectful and not make any assumptions.
If Star is like,
Pronouns? What do you mean?
Brian might respond,
I mean, do you use the pronouns he, him, she, her, they, them, or something else?
Keep in mind, singling people out can make them feel uncomfortable, so if you're in a group setting, you'll want to ask everyone what pronouns they use, not just the people you're unsure about. And be sure to share your pronouns as well. Whether you realize it or not, by doing this on a regular basis, you're changing the culture around you.
So just a reminder of a pronoun fact sheet that we have on our website. Again, as you heard in the video, many people are using he or she or they as their pronouns, but many people may have other pronouns that they use. So if you'd like to see a conjugation chart, there are many on the internet, but we have one on our website as well. Let's move on to talk about general or broad barriers to care for trans survivors. So we're going to talk a little bit about some overarching barriers, and then we'll get more specific as time goes on. A surprising 19% of trans folks have said that they were denied care, denied medical care, based on their trans identity or their trans experience. So that's 1 in 5 people. So that is really profound. So that is something that may really alter whether somebody who's been assaulted will seek medical care following their assault, given their prior experience or what they know from others in their trans circle. We also know that between 20 and 31% of trans folks fear going to medical providers or having interactions with providers for fear of being disrespected or being mistreated. We also know that between 24 and 42% of trans people have had negative experiences with their healthcare providers. So we can look at all of those things together and go, it's not very likely that somebody's going to want to seek medical care following a forensic exam. To add a little bit more weight to this, if that wasn't heavy enough already, when we look at abuse that happens within medical settings, of the trans people that were surveyed in this really large survey, they found that 26% of trans folks were physically assaulted by a healthcare provider, and 10% were assaulted by a healthcare provider. So that's a substantial number of people that have experienced direct assault within a healthcare provider's office. At Forge, we've also, validated those numbers, and we've seen similar numbers in our research and surveying. We know that there might be untreated injuries that happen with sexual assault, and body dysphoria may increase that inability for folks to seek or find care. We know that sometimes it's really difficult for trans folks to talk about their bodies and to share their experiences of what's happened, the traumatic things that have happened, as well as the everyday things that happen. So as a result, sometimes those injuries that they experienced in a sexual assault go untreated because they feel so uncomfortable or so untrusting for good reason in sharing that with medical providers. I'd like to share with you another short video, and this is from a film that's quite old, but still quite relevant, called Transforming Healthcare. It's a very short video. The whole thing is, and the clip that I'm going to share with you is also very short. So it shares a clip of Yosinio, who's talking about the respect and the relationship that he developed with an OBGYN provider around needing his hysterectomy and proceeding through actually moving towards a hysterectomy. So again, I know we're talking about sexual assault today, but the interaction that he had with this provider is really essential, and I think will be meaningful to many of you who are watching today.
The first time that my first doctor, my primary doctor, when I told her, I'm bleeding a lot, I don't know what's going on here, I feel horrible, I'm in a lot of pain, I can't concentrate, blah, blah, blah. And she said, okay, so clearly there's something wrong with you, we need to get to the bottom of this, I want to order some tests, I want to tell you what I think it might be, I want to tell you what the protocol that we might have to go through. That to me was a very positive experience. And it was because she was so open with me, and she was so willing to accept that there was something wrong, that I wasn't just crazy, and that I wasn't just trying to get free surgery. Because she did that, I felt comfortable coming out to her. And then she felt comfortable saying, okay, you're going to have to help me to understand some things, and you're going to have to help me to make sure that I say the right words, and I hope that you will forgive me if I don't. And we still need to do blah, 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 blah. That was the most, out of that whole thing around getting the hysterectomy, that was the most positive experience I had ever had. And to this day, I hold that doctor up as the best doctor I ever had because she cared and she treated me with respect.
So we're going to shift to talking about some other barriers that trans folks may be experiencing when trying to access or thinking about accessing care following an assault. Some of you may have seen this slide in other presentations that we've done, and I just want to remind folks that for many trans folks, the folks are living at a point of really caring most about their basic needs. So if somebody is wondering if they're going to have a roof over their head or if they're going to be able to access food or other basic resources, seeking care following a sexual assault may be really low down on their priority list. So we really want to just keep that in mind front and center about where trans people are living, where their resources are, and what that means to accessing the care that they need and deserve. One trans survivor said, "I haven't had a warm place to sleep for 3 weeks. The only food I've had comes from grabbing food from my tricks houses." So this again is just a reminder of where some people are and how they are living. A second thing to bring up is this concept that is highly framing most of the work that we all do, which is the violence against women paradigm. So there's a general societal presumption that women are victims, men are perpetrators. And so those messages go out to everybody, including to trans people. So many trans people may feel like if they don't fall into those two gendered sections, female victims, male perpetrators, that they may not have experienced sexual assault. So some of that is about how do we deconstruct in our world that men can be survivors, women can be perpetrators, trans people can be victims or perpetrators. How can we break some of those gender binaries down when it relates to sexual victimization? So again, a lot of that erases trans survivors, that overarching theory, and people will question if they're a survivor or not. Some of the things that we've heard from survivors, and these two are quotes from some surveys that we've conducted, is that a lot of times this violence against women paradigm translates in ways that are not very helpful for survivors. For example, one trans man wrote in a narrative part of one of our surveys that they were too embarrassed to admit being sexually assaulted as a trans man. So they believed that as a trans man, they were not vulnerable to being assaulted. They believed that they were safe when they transitioned to living as male. On the other hand, when we look at some trans women, we've heard this from many, many trans women, that being sexually assaulted almost validates their life as a woman because they believe that women are the victims of sexual assault, that it's to be expected. So the quote on the screen is, this is what it means to be a woman. And so that's really, really profound and really sad. But some of those gendered messages that are coming forward into trans people's lives and becoming part of their emotional and mental reality. We can look at law enforcement as a potential barrier. Of course, we know that many law enforcement officers are fantastic at what they do, but it's common for survivors of any gender to have a lot of challenges with the criminal justice system, not being believed, a lot of things that we already, are very familiar with. We also know that trans people may be experiencing slightly higher rates of police misconduct and police violence. So that's something that may influence whether somebody wants to report a crime or may want to even pursue evidence collection. There are also a lot of concerns about being outed in the process of contacting law enforcement or the criminal justice kind of process. So, for trans folks that are concerned about being outed, it might not just be being outed as a sexual assault survivor, but, does that affect their job or their relationship or their status in the community or their overall safety. From the data that we have, we know that between 51 and 71% of trans folks never or only sometimes are treated with respect by law enforcement over the past year. So that's a pretty high number. And so that just is another reminder of why people may not want to engage with law enforcement. So I'd like to share with you two quotes around trans folks and law enforcement. So the first quote is, they referred to me as female at first, but after they checked my ID, they referred to me as male. They treated me as a prostitute and told me to leave or I'd be arrested. Not very encouraging, right, for people to continue to access care or to talk with law enforcement. A second quote that references law enforcement says, my M to F, so my male to female girlfriend, was raped and laughed out of the office by the police. I wouldn't subject myself to that. This shit is serious. So survivors should never be laughed at. And so, this is just an obvious quote of just the profound nature of misconduct by a professional who should know better. We can look at cultural sensitivity or insensitivity, and we know that it's hard to stay up on everything and every issue. And one of the things that we hear commonly from trans survivors is that the professionals that they're working with just don't have the skills or the language or the knowledge that is needed to work effectively with them as trans survivors. We know that sometimes the cultural insensitivity is intentional, but more often than not, it's unintentional. It's just the lack of knowledge. So we see this most in people asking intrusive questions, oftentimes asking about genitals and surgery status and things that just are really irrelevant to the care that they're seeking. And oftentimes that results in unequal services or discrimination. So a couple of quotes to kind of highlight what it means to be culturally insensitive. So this first quote says, the therapist I see specializes in sexual assault and sexuality, but she doesn't know jack about trans issues beyond what Wikipedia offers. I have to educate you all the time, and sometimes she's just not up for it. It sucks. I want to point out there that the tense changed in the middle of that. So this person has such strong emotions that it shifted from she to you as it was being reported. So, this is traumatic to not have a provider who's competent, and it really bleeds through sometimes in how they even share about that cultural insensitivity. So the second quote is, they turned me away when I sought short-term counseling about being a support person for a close friend who went through a very violent assault. They said my issues were too complex and they couldn't work with me short-term, even around short-term issues like supporting my friend until she found out whether she acquired hepatitis C from the assault. A third example is a friend was recently asked by a nurse, why do you look like a boy? Again, a question that nobody should ever have to hear from a provider that they're seeking care from. And the fourth and last quote to share with you on cultural insensitivity is, quote, transphobia and lack of understanding of trans issues would be the biggest barrier. If I'm having a hard time explaining my gender in regular social settings, I would be even more petrified to explain it in a sensitive situation, such as a sexual assault. So we can look at identity documents as an additional barrier. So many times trans folks will have identity documents that others may see as incongruent. They might not be incongruent to the person that holds those documents, but they may, walk through the world looking male to others, but might have an F on their driver's license, for example. So that's what the incongruity means. A lot of times what that ends up meaning is that people are questioned about who they are. Are you really who you say you are? They may be denied services because people think that they are not real or valid as a person. I just want to remind folks that many times folks may want to change their IDs, but cost might be a barrier. So sometimes there's a desire to change documents, sometimes there's not. Another reminder around identity documents is around people's immigration status. So that's less to do about gender identity or expression, but just another piece of identity documents that may play a role in how somebody accesses care. So the quote that I'd like to share with you about identity documents really shares the significance of the serious implications that these documents can have. So the quote is, people, we still have so much to do to make sexual health services aware of and positively responsive to trans identities. I just left a clinic in tears, having tried to register for a pap test. Getting there was hard enough. Being humiliated by the receptionist holding up my health card in front of them, in front of my eyes, and tapping where the girl name still says, where the girl name still is, and saying, your name is not Robin. Well, while 3 clients looked on, it's just too much to handle. I left without getting the pap. When I go back, I'll take a friend. So some of you may have seen this quote before in prior trainings. It's a quote that I have used a lot. And this happens to be a friend and a colleague of mine who ended up dying of GYN-related cancer. So it always makes me wonder if he would have been able to survive if he was treated appropriately and not treated so disrespectfully. The political climate is the last kind of generalized thing that I'd like to share as a barrier. We know that the political climate, no matter what that climate is, can change how comfortable it is that people feel in terms of being out. If they fear their immigration status, if they fear for their safety, if they're concerned about being treated well or being treated at all, they may be concerned about some of the state or local or federal rollbacks. So we've heard in the last several years, there have been rollbacks to Health and Human Services, to trans people in the military, to employment protections. There's some good news there, but there's also some negatives there. To Title VII, which there's also some good news there. The Affordable Care Act, religious freedom, bathroom access bills, things like that. So the political climate can influence how we all think about our safety and whether or not we want to receive services, or if that is just too painful or difficult or potentially dangerous. Let's spend a moment looking at body dysphoria. So survivors of all genders may experience body dysphoria. And I'd actually probably widen the lens a little bit back on that and say that just about everybody in America experiences some level of body dysphoria. We're all sent messages about what people should look like and what people of certain genders should look like. So dysphoria is not an uncommon phenomenon for people to be experiencing. Trans and non-binary survivors might have some additional layers of discomfort and unease around their bodies. So these things might be assault-based, or they might be gender-based, or there might be a confluence of both of those things or other things that are adding to their dysphoria and their discomfort. So some of the implications that this has, that dysphoria has for trans survivors seeking forensic care, is that they may be really uncomfortable to have others examine them, for others to see or interact with their body. They may also want to limit their support or the services that they receive to only one provider, or only a specific therapist, or only a specific place. And that, of course, is going to change the range of services that are available to them if they only feel comfortable with a certain limited number of people. So I wanted to add a little bit, kind of a sidebar on disclosure. Disclosure is something that is a little bit of a hot topic for a lot of people. People are always thinking that disclosure is something that is required of trans folks. So I want to reinforce very strongly that non-disclosure is not about deception. In general, people want to have control over what is shared about their life. So it's just a really simple thing of like, do I want to disclose that I'm trans or do I not? That's something that I have within my control. And for survivors, having control over their own narrative is extremely important. We want to make sure that survivors can tell their story and tell their history in whatever way is right for them, that empowers them. We also know that there's a right to privacy. That, being trans is something that people may want to keep as private information, and we need to respect that and understand that that is where it's at. I also want to be really specific about when a survivor is coming in for care, they're juggling a lot of what's important to share, to communicate with providers, and it may be hard to bring forward the trans piece when it's already hard to seek victim services around a recent assault. So that disclosure piece might be forgotten. It may be lower on the priority list. A lot of things that might be factoring into that. So when we look at if trans survivors should disclose or when trans survivors should disclose, obviously these are things that are up to that survivor as to when and how they disclose or if they disclose. And again, the disability community talks a lot about spoons. How many spoons do you have left? You get a certain number of spoons in a day, and when your spoons are out, you're done for the day. So how many spoons does that survivor have left? Do they have their sharing their trans status spoon still in their back pocket? I wanted to share a personal example of what is most important to me. So if I was seeking forensic care or medical care after assault, the first things that I would want to share with somebody, the most critical things both to my life and my health and my safety, is to let providers know that I am very allergic to parabens and very allergic to local anesthetics. Those two things are far more important than letting somebody know if I'm trans or if I'm queer or any other piece. So, for any trans survivor, they may have something that's really specific that they need to make sure that is known by that provider that they're seeking care from. And again, for me, it's about what I'm allergic to, more so than what my identity is or is not. So a reminder of why it's really important to create a safe environment is that when somebody doesn't disclose that they're trans, there's less opportunity for advocates or other people to help support them and create a smooth path. So again, this is not me advocating for people to disclose, but if somebody is comfortable and able to disclose their trans identity or their trans history, they may be able to access additional support, and the process might be less difficult if they can get that support from folks. And a quote about disclosure and medical settings. So this quote says, "I rarely tell doctors of my gender identity. It just seems so hard to explain what genderqueer means in a short doctor's appointment. I'm also reluctant to take the risk of discrimination. I need to be healthy more than I need to be out to my doctors. I hate making this compromise, but I'm not quite that brave yet." Unfortunately, we live in a world where people still consider talking about this as a brave issue, rather than focusing on the fact that there are still providers that are discriminatory. So I'd like to share another video clip from the same film as I showed before, from Transforming Healthcare. And this clip is, it has a couple of things in it. One is around what happens when somebody discloses they're trans in a healthcare setting, but the majority of it talks about sexually transmitted infections. And that is not necessarily what I want to bring home to folks here, but the clip is so excellent because it talks about how providers can bring up and talk about body configurations, about what type of sex somebody's having. And in this particular case, it's about consensual sex. But a lot of these concepts will translate well to sexual assault nurse examiners and medical advocates. So let's play this clip, and I think you'll understand why I'm sharing it with you.
There was one time in particular where I went to get STD testing, and the woman was like, I've never met a transgender person, ever. I don't usually work at this clinic. I do pediatrics. I don't know what to do with your body. Like, if you were a guy, I would just have you stand here. If you were a girl, I would have you lay down on the table. She was like, but I don't know what to do with you. And she was perfect. She was like right up front about it. And I was like, and I didn't know what to say. Like, I was like, I don't know how to do your job. I don't know what you're looking for. I don't know what you want me to do. And she didn't know what to do either, so we were just kind of like, take this. And then I left. And I was pissed that I didn't get healthcare. I didn't receive any healthcare.
Well, you have to admit that you're having sex. And you might have to admit that you're having unprotected sex. And you might have to admit that you're having the type of sex that your body parts would indicate you would not be having. Or that your identity would indicate that you would not be having. And some people, it's hard to do that.
I think it's important if you're talking about things that have to do with genitals, like if you're worried about someone says, I'm having burning when I pee, or, there's blood in my stool or something, then you need to talk about potential exposures, and we'll move into the sort of sexually transmitted infection area. And at that point, you need to ask you need to assess for risk of exposure. So you need to say, what kind of sex do you have? What goes in what body parts? And what body parts do you insert in someone else's body part? What body parts going into your body parts?
If I'm a gay man, I need to know, again, what is vaginal sex? Because I might be having it, but I don't call it that because I'm penetrating my gay FTM lover, but we don't call it a vagina. It's just the other hole.
It's important to ask people how they identify for themselves and how do they identify their body parts. Especially, say, for instance, if you're going to do a pap smear or a vaginal exam for a trans man, you say to them, I need to do a genital exam. How would you like me to discuss your body parts? Because I want to tell you what I'm doing when I'm doing that exam, but I want to make sure that I respect you in the process.
All right, so that was a great clip, right? Let's talk more specifically now about forensic and medical care and what some of those barriers are and what some of the considerations might be when we're looking very specifically at forensic and medical care. Let's start with navigating trans bodies in medical settings and just a few reminders. We talked a little bit about this at the beginning, so here are the reminders. Some trans people are uncomfortable in their bodies. Some people are not. Some trans bodies are different from non-trans bodies. Some are not. Some trans people's bodies have exam-specific implications. Some might not. Not everybody uses or wants to use hormones. Hormones don't make somebody more or less trans. They're just one of the options available to trans people to affirm their gender. Not everyone has or has had gender affirming surgery. Not everybody wants to. Surgery, again, is something that does not make somebody more or less trans. We need to be mindful that for many trans folks, damage to genitals, and genitals also extends in this particular case to things that are gendered about our bodies. So face, chest, genitals, or other gendered body parts. Those parts of someone's body may be damaged in the assault. So when a trans person has experienced damage in those areas, they may be thinking not so much about their care and recovery or forensic exam, but they might be thinking about the cost implication. Like, you know, this vagina cost me $50,000 to get. What does it mean if this is damaged? It may be that somebody's genitals or chest or face is really central to their identity. So a sexual assault could really impact, what does this mean about my gender identity if this part of my body is no longer the same as it was? It could have a lot of safety concerns in a lot of different ways. I mean, I think some of them are obvious about perceptions of safety, but they could also have outward levels of safety if somebody's, for example, face is scarred. So, you know, many trans women have had facial feminization surgery or take a lot of pride in their outward appearance around their face because it's a cue for other folks to see them and interact with them as trans women or as women. So there might be safety considerations if there's damage to her face. And there can be some really strong underlying messages that if there's damage to faces, chests, genitals of a trans person, that the crime was hate motivated. So those are just some things to keep in mind as we move forward. So when we are thinking about providing trans-aware care, there's a couple of overarching things that we want to make sure that we consider. So it's common with sexual assault exams, and all of you know this, to take a relatively thorough history to look at what somebody's medications are, what surgeries that they've had, what their general wellness is as part of the picture, as well as looking at what happened to them around the assault. So some reminders that, you know, trans folks may be distrusting of medical providers for many good reasons and may not want to disclose some of those things about their history, or may feel that they're being stigmatized or, you know, kind of isolated as like, well, why are you asking me these questions? Do you ask everyone these questions? So we want to remind folks that, you know, hey, we ask everyone what kind of medications they're on because we want to make sure that you're safe if we prescribe something. We want to know this information and we ask it of everyone because this helps us gather information and be able to accurately record what happened to you. So we want to make sure that we make those reminders to folks. Sometimes when we ask trans folks what medication they're on, they may not consider hormones to be medications. So it's a little bit of a tricky situation here. If we don't know that somebody's trans, we can't say, well, you know, that includes things like hormones, because that might make them feel isolated and, you know, pigeonholed. But we do want to make sure that if we do know that somebody's trans, we may want to ask if they're on hormones, because again, it may have a role in how we provide services to them. Same for surgeries. So a lot of times that people think about gender affirming surgeries as not really as surgery. I mean, of course it's surgery, but I think when asked in a medical setting, they think, oh, well, this is about, did I have my appendix out, or did I have, you know, heart surgery or something major? So sometimes we might need to be explicit about what we're asking. One of the things that's oftentimes asked is, when was your last menstrual period? So that's an uncomfortable question for a lot of folks, and this adds a lot of complexity for trans folks. Again, we may or may not know that somebody's trans. We may or may not know if somebody has a uterus and ovaries. We may or may not know, you know, what the configuration is. So just asking that question can bring up a lot of challenge for trans folks, and it may shut some people down. So we want to make sure that we're asking those questions in a very kind and open and respectful way. Again, when we look at what typically happens within a forensic exam, we know that a lot of times it's literally a head to toe exam when that's consensual. And we want to make sure with trans folks, just like with everyone else, that we're talking about consent. We're talking about, here's what I would like to do next. Is that okay with you? Are you comfortable with that? How can I make this more comfortable for you? And we want to obviously respect if a trans person says, no, I don't want to take off my shirt, or no, I don't want to, whatever it is, we want to respect where that person is. So we really also want to make sure that we stay focused on why somebody's there. I know that forensic nurse examiners are extremely, extremely good at this. And this is one of the things that I often proudly proclaim about sane nurses, which is that, you all tend to get it better than the majority of medical providers. And that is that you know how to stay focused on why someone's there. And there's usually not a lot of extraneous questions that are asked. So I encourage you to keep doing that survivor-centered care and staying focused on where people are. A second kind of broad issue is around charting. So we want to make sure that we share why and how we're charting the way we chart. So a lot of times our agencies dictate what kind of forms we have and what kind of body maps we might use to chart injuries. A trans person may look over at you making notes and see that you've pulled out a body map that might be a gender that they don't identify as. So it's really important to say to somebody, I want to document your injuries as accurately as possible. So therefore, I'm going to use, this body map, and I'm going to try to, respectfully show where your injuries are to the best of my ability, and so that it's as accurate as possible, especially if you want to move forward and engage in legal action. We want to make sure that it's a good medical record. So those are some things that we may have conversations about that may be a little bit difficult to do and difficult for that trans person to be watching what's happening. We also want to have some discussions with folks about their outness and safety in medical records. So somebody may not be out to their health insurance provider, and they may need to have additional health care following, assault that has some serious medical implications. So if the nurse is documenting and using the pronouns that the person uses, but is not in line with some of their other documentation, they may not be comfortable with you using their affirmed pronouns, for example, or their affirmed name. So having that discussion about what name and what pronouns get documented is really important. Again, maybe a little bit difficult to have, but we want to respect their long-term safety and their immediate needs. And of course, forensic nurse examiners do this really well in reflecting the language that survivors use. Trans folks, again, may use language to reflect their body and their body parts in ways that you may not have heard before, maybe in ways that you have heard before. And the job of a forensic nurse examiner is obviously to reflect those words back to the survivor and to affirm those identities and those pieces of who they are. And at the same time, we oftentimes need to make sure that what we're writing is legally defensible if somebody may want to pursue legal action. A little bit more on medical records. In theory, medical records would be private, but that's not always true in a lot of different ways, as many of us know. So many times medical records go to insurance companies. They generally don't go to work, but sometimes they go to work depending on where that insurance company is. Sometimes there might be access by people in somebody's personal life to medical records if they have access, if they share their medical records with their partner or with somebody else in their life. The medical records may go to a legal system. And there could be a lot of concerns around the safety and the confidentiality of those electronic medical records. And this could be a particular concern if photos are taken within that forensic exam. So people might be really worried about what's in their record, who has access to it, and how can they protect their privacy and their trans history. We talked a minute ago about hate-motivated crimes and how sometimes hate-motivated crimes tend to target a little bit more people's face, chest, and genitals. I wanted to just bring up here that for many trans sexual assault survivors, there might be a hate-motivated crime piece of that interaction. There also may not be. It may not have anything to do with somebody's trans identity, but it might. So again, having conversations with that patient in front of you, ideally you'd want to document any quotes or slurs or threats that a perpetrator made that might be trans linked. So if somebody makes an anti-trans comment or a threat to the survivor, that would want to be something that would be included in the documentation. Of course, we'd want to make sure that the gender-focused injuries are charted, just like all of the other injuries are charted. And we may need to engage in some additional layers of safety planning with that client, because there may be safety issues when they leave the office that are related to that hate-motivated crime and who that perpetrator is and where that perpetrator is. And of course, all of that, the caveat again is we want to confirm with the survivor before we document to make sure that they're comfortable and safe in terms of what we record. So let's look next at providing trans-aware exam-specific care. So this is really where probably many of you were hoping that we would get to. And hopefully the framing of this was useful to get to this point. So when we're looking at and working with transmasculine folks, it's really important to remember that if somebody has ovaries and a uterus and their perpetration was penile vaginal, and I'm using more medical language rather than trans-affirming language that might be unique to the trans person. If somebody has an ovary and uterus, if somebody has had penile vaginal penetration, there is a possibility of pregnancy. Testosterone doesn't mean that somebody automatically will not get pregnant. Sometimes people think that that's true, but it's not true. Clients should be always offered pregnancy screening and offered emergency contraception options. A lot of times we hear that trans men are worried that emergency contraception might mean that it's going to make them feminine, or it's going to be female hormones, or what does that mean? So some education might be necessary in that process. I will say that having these discussions is, I think, really challenging to be gentle and respectful, because I think a lot of times trans men don't realize that they may be able to get pregnant if they're already on testosterone. So being really careful and gentle in bringing that up, but also wanting to make sure that preventive care can happen. So those are some challenges with that. Another specific example of where care needs to be taken is around trans men or transmasculine folks and vaginal exams. So again, we want to reflect language to, probably not call it a vagina, but call it whatever that person is sharing as their language. When folks are on testosterone, there's oftentimes vaginal atrophy. Even sometimes without testosterone, people may not use that part of their body, and so it may atrophy as well. There can be some dissociation or disconnect, even without trauma, around that part of their body. So even if somebody is having consensual penetration, it's not often desired because it's unused or because of the testosterone atrophy. So we want to make sure that we're sensitive and aware of the fact that somebody may be checking out a little bit and having a harder time being present. That's not necessarily a bad thing or a good thing, just something to be aware of. We know that the use of pediatric speculums are oftentimes very effective and more comfortable and a little bit less traumatic for folks than the adult speculums. We also know that it's important to offer some alternatives to speculum-based evidence collection. And that might include using swabs only. It might include some hair samples only. It might include a lot of different things, but we want to talk to our clients about what would be comfortable for them in that exam process. And recently I've been talking with some forensic nurse examiners who've talked about, there may be even a desire or a benefit in using some sedation for an exam or some repair if there's serious damage, physical damage, so that it takes away the trauma that's related to somebody's gender in order to get that evidence collected or the repair needed. Let's talk a little bit about trans women or trans feminine folks and vaginal exams. So we talked about trans men or trans masculine folks. Trans women or trans feminine folks who have had constructive vaginas are, often sexually assaulted in that part of their body as well as other parts of their body. And we need to recognize that those surgically constructed vaginas are oftentimes less elastic than folks who had the factory-equipped models of vaginas. We also know that there is an increased risk of tearing, both at the entry and because of width or depth of that constructed vagina. We know that people may not consensually use that part of their body for consensual penetration or sexuality, and they may not regularly dilate. So those are some factors that may make it more difficult for a vaginal exam. So some of the things that we talked about with trans men apply here. So using swabs as an alternative, using a pediatric speculum, being really creative about how that process plays out. I wanted to note too that trans men, this is appropriate to talk about as well, but for trans women and trans feminine folks, there may be a slightly different STI or sexually transmitted infection risk. So there may be some risks because estrogen may make the skin more fragile. So either vaginal skin or other forms of skin more sensitive and more permeable to sexually transmitted infections. Of course, anal penetration carries the same risk for STIs and HIV as for non-trans women. One of the really good and kind of cool things about our world right now is that more and more folks have access to PrEP. So that pre-exposure therapy is really, really useful for decreasing the likelihood of HIV transmission. Doesn't change the other STIs, but it may help people from becoming HIV infected. One thing that is more common in trans populations than non-trans is the use of injected silicone. And the injected silicone that is done at pumping parties or oftentimes in the kind of the underground economy, underground access. I think many of us know that injected silicone is very dangerous to bodies and can cause some both short and long-term physical harm to people's bodies. The but and the and to that is that it still is happening, and many trans folks who can't afford surgery are opting to use silicone to enhance their gender and their appearance. So we need to be really careful, and we need to be mindful that silicone may be dislodged in an assault. So if there was physical violence or something that jarred that silicone, it may require additional medical care. And that's oftentimes a difficult thing, and I will leave that to medical folks to explore what that means. But we just need to be mindful of that when we're working with trans survivors, particularly trans women, where silicone use is more common. Another thing I wanted to note is that as we're looking and as we're kind of doing that head-to-toe exam to look for where there was injury, where there was harm as a result of trauma, I want folks to make sure that you remember that there are things that you might see that are not necessarily about trauma. And so that has to have some discussion with your client about what things might be. So a common example, and you can see on the screen, there's a person's shoulder and there's a bruise on that person's shoulder. A forensic nurse examiner may, question if that was related to the assault. This particular picture is of somebody who uses a binder, and it's a binder that goes over their shoulders as well as over their chest. And because their binder is so tight, it creates almost a permanent bruise on their shoulder. So that's something that we might have to sensitively ask about and talk about. People may also have bruising or even cuts if they bind with a different kind of binder, that the cuts are like across their chest or across their belly because of where that binder lies. There might be some other long-lasting marks based on prosthetics and based on what people are using to express their gender. There may be some adhesive residue, and I was trying to think as I was developing this webinar of what the language would be for that. But people who gaff or who basically are tucking their penis to pull it back under sometimes use tape. Sometimes, unfortunately, for their body and for their comfort, they're using tape that is quite adhesive. And that may cause kind of some permanent, almost permanent kind of stickiness and adhesion to that part of their body. So we might be seeing things like that that are not at all about trauma, but just about what their body is like every day. We also may see things like non-suicidal self-imagery. Cutting is extremely common for folks. It's extremely common for trans men, more so than trans women. I think the non-binary folks are kind of in the same category as trans men for the levels of cutting. So a lot of folks cut for lots of different reasons. No stigma or shame with that. But again, we may see cuts on somebody's arm and wonder what that is from. So when we have a youth that is presenting for a sexual assault exam, we want to be really aware of the difference between consent and assent. And you all know what the difference is between those things, but when we're working with kids, and I'm using kids to mean little kids up through even teenagers where that age of consent is, if a parent or an adult is bringing somebody in, the kid may feel more needing to comply with exams or agree to things because their parent or guardian or adult is there with them. So we just want to make sure that we can have some private moments with that youth and make sure that they are consenting to the exam and what's happening. We also need to be very aware of who the perpetrator might be. So, in so many cases of sexual assault, it's somebody that is known to the person. So for a youth, it might be their offender that's bringing them in. It might be their parent or their other loved one. So again, we want to be able to try to get that youth alone for at least part of the time to be able to determine, who harmed them. We may also see that there's delayed disclosure of assault. So, it's hard being a kid, it's hard being a youth, it's hard to talk to your parents or your guardians or adults. It may be especially difficult to talk to them about sexual assault or something that happened. So many times people might be seeking forensic care and it's too late for evidence collection, at least the more biologically based evidence collection that might have DNA in it. There still might be some things that we can examine and care for and do some prophylactic care, specifically around STIs or pregnancy. But that delayed disclosure might impact what we can do for them. Just a reminder too, and all of you know this, but the legal age of consent for sex is different in different states. And there might be a difference between if an adult in a youth's life considers any sexual activity as sexual assault, which statutorily it might be, versus the youth that might consider their behavior as consensual. So there just might be a difference there. Also want to be aware of things like state and territorial and tribal laws on reporting and confidentiality. All of you are likely mandatory reporters. So how does that play a role if a youth is coming in by themselves? And what are the implications, the negative implications of if that information goes to their parents? You also may be seeing some homeless youth. So again, some challenges there in terms of how do we make sure that youth gets follow-up medical care, gets their medications? They may not have access to some of those things. And we definitely want to support youth in the criminal justice system if that is something that they are wanting to pursue. So let's talk for a moment about crime victim compensation. So I believe it's true in every state that in order to qualify for crime victim compensation, that law enforcement is required to be involved at some level. A report to law enforcement is required. So we talked earlier about the mistrust of law enforcement by many trans folks and the police misconduct. So this may be a deal breaker right away. If somebody would like to access crime victim compensation, but they know that they have to seek out legal or law enforcement, they may not want to go down that route. They might be outed as trans, and that might have some implications if they want to fill out the paperwork for crime victim compensation. One of the things that is very, very trans-specific is that we're finding that many states are not covering prosthetics that might have been damaged under crime victim compensation. So binders or wigs or breast forms, other things that are really essential to that person's identity and safety may not be covered. We also know that there are some trans-specific medical care that is not covered. So when we talked before about how genitals or chests or faces may be damaged in an assault, sometimes crime victim compensation is not wanting to cover the surgical costs of repair for folks. So let's take, for example, a trans woman who had breast implants, and that breast implant was somehow punctured in the assault. So some crime victims compensation, if they know that that person is trans, may not cover the reconstruction to re-put in that one side breast implant. So there's some challenges with that. The other small bit of awareness is that some trans folks engage in underground economy and may engage in sex work. And if this is something that happened during a sex work engagement, crime victim compensation says that you can't be actively involved in a crime in order to receive support. So if a state considers sex work a crime and this person was sexually assaulted, they would likely be disqualified to receive compensation. So just some things to keep in mind around that. So when we look at evidence collection and safety concerns, we know that for many, many trans folks, things like wigs and prosthetics and clothes are essential for presenting as someone's affirmed gender. Many sexual assault treatment facilities don't stock items that would fit folks. So like if folks are asked to leave items of clothing or their wig or their prosthetics to be held as evidence, there may not be an easy replacement in stock at that facility. So, if a trans woman is, 6'2" and I'm not good with women's sizes, but wears larger sized women's clothes, she may not have an option of selecting clothes that would fit her in order to leave her clothes for evidence. And I think the most important part is really about safety. So people may not want to leave without certain things that they came in with because of safety on the streets. So again, if we looked at like a trans woman who regularly wears a wig and her head does not have hair on it normally, she might be very physically unsafe if she walks out of that exam without her wig. So we may want to problem solve with her and talk about it, but she likely will want to maintain her wig. So maybe we can take a small sample, we can swab, we can do some things that will collect evidence, but still allow her to be safe when she leaves the door. So let's look at what you all can do to make life better for the folks that you are serving. So the first one is really getting off on the right foot. So again, we're kind of coming back to the beginning, introducing yourself with your name and pronouns and asking others what their name and pronouns are. So we want to create that safe environment and supportive environment right from the start. We want to mirror language. So again, we want to do this with all of our clients, but trans people may use language that you're not familiar with about their bodies or their identities or their experiences. Reflect that back. If you're unsure of what something means, you can always ask for clarification in a kind and gentle way, just like you would when anybody uses a word that you don't know. It's especially important to reflect language when we're talking with a client around their genitals or their chest or their face. We really want to make sure that those gendered body parts are reflected in a way that is affirming to that person. So the third thing is to chart and document in ways that are respectful. We talked about this already, but just these are the reminders of what you can do. Reflect the client's language, check in about the implications of gendered documentation and that person's safety. So we already covered that, but that's just the reminder of what you can do to make things better. You can empower survivors' choice at every step. And again, this is something that forensic nurses do really, really, really well. Oftentimes, forensic nurses will say, and this is what's going to happen next. Do you feel comfortable with this? Would you like to do this? All of those questions and giving people buy-in at every single step. This is particularly important for trans folks who might be really protective of their body or their experience or what they want to share. So asking and empowering at every step of the way. The fifth thing is being trans informed with follow-up resources. So a lot of times when a survivor leaves, we give them a packet of materials to, have for later so that they can reference and they can receive more support after they've left our office. So is the referral list that you hand out, are they trans knowledgeable? And that might be physicians or therapists or support groups or shelters or lawyers or pick the profession. Do you know who's on that list and if they have worked with trans folks before and know about trans issues? What kinds of literature do you have that goes in that packet that goes out with somebody or that you have as a resource? Do you have one of our palm cards that you can hand people? We would be happy to send you some that has resources directly for trans survivors. Those are the kinds of things to think about. The sixth thing is to partner with trans orgs. So we want to make sure that both victim service agencies, which includes folks that are doing forensic exams, and trans organizations are working together, not necessarily intensively, but we want to be able to share resources with each other. We want to make sure that each kind of side of that equation knows about what the other does, so that if a trans org has somebody that was sexually assaulted, they know about where to send somebody if that person needs additional care. Same for sexual assault agencies, and so it goes both ways. There's opportunities for cross-training, so that really enhances the egalitarian nature of that partnership. There's an opportunity to develop trans-specific resources together. There's also an opportunity for trans organizations and trans supporters to feel really empowered by being able to donate things like wigs and binders to supply closets at forensic exam locations and to rape crisis centers and other places, so that trans folks can have a resupply of the things that are important to them. We may want to know who some of the LGBT-friendly advocates are that are familiar with working with sexual assault survivors. So it's not a necessity to have a trans person work with a trans advocate, but sometimes that's something that we can offer to folks. And the last reminder is around being creative. We really want to make sure that we follow best practices in working with clients, and we need to be creative. So we've talked along the way today about how some of that creativity plays out. And I know very well that so many of you are very creative in how you work with the survivors that you see. And so to close out today, I wanted to share just a few resources of places that you may want to just kind of bookmark for later reference. The first one is this reference for gender neutral body maps. It's a great reference. I think it's one of the best places, and it's the best set of forms. And I'm aware that many places, where you're working may require you to use certain forms and certain body maps, but this is something that you may want to advocate for if your agency only has male and female body maps. All of you, I'm sure, already know about the safeta.org website, but again, lots of information there that is LGBT inclusive and trans inclusive. We know that Forge has worked a lot with IAFN, for our interpreters, IAFN, the International Association of Forensic Nurses. And they have been very, very mindful and active in making sure that their resources are trans informed and trans inclusive. Two of those publications that IAFN has been part of in creating are the National Protocol for Sexual Assault Medical Forensic Examiners, which is definitely trans inclusive. So Forge did a kind of a pullout of where the trans references are in that guide. So we encourage you to look at the guide itself, which I'm sure, like, again, all of you are familiar with, but also see where there's trans references in it. And the same is true for the pediatric protocol. So we were involved with both of them in terms of, helping make sure that they were both trans inclusive. So please be mindful of that and look for where, you might need some support or guidance within those two protocols. I wanted to share with you an old webinar that we recorded in 2014, which seems like forever ago. But Kim Day and Eric Stiles did this webinar as part of a series that we were doing. And there's a lot of really amazing information in there. Kim Day is fantastic. And nobody can beat Kim Day. But Eric Stiles also offers some really great advice for medical advocates, which is different than what we covered today. So encourage you to check that out. Another oldie but goodie is we worked with the Office for Victims of Crime in creating a sexual assault toolkit. And this is quite old, but it does specifically have information in it for healthcare providers and for advocates that may be useful to some folks. We also have a very short handout on what's important to trans survivors, just to kind of help remind folks of what is the most critical for many trans survivors. I also wanted to highlight the Trans-Pacific Safety Planning Tool. Again, this is a little bit on the old side, but Trans-Pacific Safety Planning is pretty constant, and we encourage you to use that if you're safety planning with clients. One of the last resources to share with you is this healthcare provider preparing your work to practice to support trans survivors. It's a healthy relationships card. It's trans-specific. It's a great card that Futures Without Violence initiated and partnered with many organizations to create. It's intended for healthcare providers to hand to their clients and clients to hand to their healthcare providers. So we would be happy to send you some. You could also get them for free as well from Futures Without Violence. We encourage you to keep learning, and that keeping learning can be about trans folks. It can be about racism. It can be about ableism. Whatever it is that you need to keep learning about, we encourage you to keep learning. Really quickly, I just wanted to share with you a little bit about what we can offer you and where you can keep learning with us if you'd like to keep learning with us. So we do a lot of technical assistance and training. So webinars like this are certainly part of that menu. One-on-one support is probably the most common type of TA that we receive. So write us or ask us a question and we will work with you on finding a solution. There are many publications on our website and archived trainings on our website that you can access, as well as we can do site visits with you all. So even in our COVID world, we are finding ways of engaging in site visits with folks if that's desired. We also work, again, that 25% is working with trans survivors themselves. So we offer many of the same services for trans survivors to make sure that they have the resources that they need that are trans specific. So conferences when we're not in the COVID crisis, publications, webinars, support-based groups, and online presence. So definitely please connect with us or connect your survivors with us. The last two things are just to remind folks of our website where all of those things that I just mentioned are housed. We would love to have your feedback on anything or even your suggestions of where else would be helpful for you, for us to create. And if you'd like to stay in contact with us, this is where we would be sharing most of our new resources is on social media like the rest of the world. So you can find us on Facebook or Twitter or Instagram or on YouTube. So please connect with us. We'd like to connect with you as well. So if you would like to get in touch with me directly, you can reach me at mmunson@forge-forward.org. And I would be happy to engage with you on any question that you might have about this webinar or on anything else that is on your mind and that you are challenged with or would like to have some discussion about. I really appreciate that you spent so much time with me today. And I hope that you have gained something from our discussion and sharing. We really care that trans survivors are treated with respect, and we know that you care about that as well. So thank you for your time and for your continued care for the trans survivors that you work with.